On to what both Steve and Doug said. First of all, getting the public more comfortable, putting in place the right policies so that everyone in the space is comfortable with data being transportable. We're no longer in that paper environment where you have a piece of paper, signed piece of paper in front of you. All of this information is moving around electronically, so it's very important to have in place the right policies, but also, as Doug had indicated, from a standards perspective, and this applies specifically to Social Security, because we are looking for as much computable data as possible contained in the electronic health records. Well, in order to compute that data and in order to be able to interpret the medical summary information to make a disability determination, there's a certain amount of interoperability and standards that are required to do that. Social Security has an extremely large repository of medical records. Right now it's unstructured information. We'd like to make the move more towards structured data, again, to provide the decision support to our examiners and help assist in the disability process. But that is going to cause some standards to be put in place, specifically as we expand our nationwide health information network model with ONC. We're going to need to solve some issues surrounding patient and provider identification.
Yep.
Just to camp onto that, one other area is, and Doug had mentioned already, about being able to promote the value proposition to this. A national health information exchange model will be needed. There are multiple use cases to support it. From a Social Security perspective, we have hitched our wagon, so to speak, to the Nationwide Health Information Network exchange model, but there are also use cases to be considered in terms of connecting the consumer to provider, as well as others, as Steve had mentioned.
Right.